Thank you very much. I'm Nicole from the New England College of Optometry, and today we're going to talk about different vision assessments that are inclusive for individuals who are nonverbal. And so this problem is relevant to patients who have cerebral or cortical visual impairment, which is the most common cause of pediatric vision impairment in the US and developed world. And this visual impairment is caused by interruption to the visual pathways or visual processing areas of the brain. And CVI is really characterized by functional vision problems that can't be adequately explained by a structural issue with the eye, and it's really the visual centers of the brain that have difficulty processing and interpreting the information. And children with CVI often have other neurological and other medical conditions and also have multiple impairments. Visual acuity, contrast sensitivity, and field may be impaired, but it also may be normal in this group. And the issues, as I mentioned, are really with the visual processing, and so they aren't really adequately represented or captured on standard clinical tests. And previous work in this area has shown that these individuals have deficits in facial recognition, psychophysical tasks, visual search time and strategy, and also in motion perception. So a comprehensive assessment for these individuals is needed, having multiple tests to assess the integrity of different visual pathways. And these visual function measures psychophysically require a patient to learn a new task and a new set of stimuli and to complete many, many trials. And all of those factors confound attention, learning, memory effects, and the duration can be quite long. And so as a consequence of this, all of the previous research has really only included individuals who were verbal, who had no other impairments or disabilities, and the rest of the group that really represent the majority of individuals with CVI are often left out. So we wanted to develop and explore the use of eye-tracking-based visual psychophysics tasks to measure a range of functional endpoints, including contrast sensitivity and acuity, but also color perception, pattern recognition, and motion perception and stereo acuity. And while eye-tracking paradigms had previously been utilized to measure acuity, field, and contrast, for this population, we really thought it important to measure parameters such as motion perception and pattern recognition or form perception. So we record our participants' gaze direction towards a target stimulus that moves in a semi-random path using a gaze point eye tracker. The target is a Gaussian patch that defines sort of the intensity of the stimulus signal, and it decreases in intensity as it moves away from the center. And this signal can be adapted. It can be luminance of color contrast, as is pictured here, or it can be stereoscopic disparity, form, coherence, motion coherence, among others. And the speed of the target is fixed at 4 degrees per second, which generates reliable smooth pursuit movements, and the direction of the target is random. So as we look at these psychophysical tasks, we can come up with good measures, good psychophysical metrics in terms of looking at the tracking error on the y-axis versus the target contrast. And as the tracking error increases, we define a threshold of about 60% accuracy. So this is an example of our form perception or pattern recognition task. So we're looking for a swirled pattern in the center, which is more coherent at the start, looking at sort of the Gaussian here is defining sort of the signal versus noise element. And again, we can measure a similar psychophysical function. And this is first tested in subjects with normal vision just to make sure the parameters are all correct. So as you can see, the pattern in the center, we can recognize the swirled, and then it becomes less coherent over time as people follow it away from the center. So when we compare these sort of tasks to other clinical tasks in terms of stereo acuity or other mouse-based psychophysical tasks, we do find differences with lower thresholds on these eye movement-based tasks. but there's sort of a constant log difference, so we could perhaps predict performance from the eye tracking and predict how it transfers to other clinical tasks, and that's something we're going to continue to work on as we now move to looking at suprathreshold and threshold stimuli in this sample of neurotypical children and those with CVI. Thank you.